talking every time if there are any questions. Anyways, how many of you have submitted your cases for reports? Talking about risk and benefits, I mean, we do place a lot of emphasis on risks, but remember one thing: the biggest risk is not to take any risk in life. Yes, we should be willing to take risks, but yes, I mean, at least medical science and education and our training has taught us that these risks have to be calculated and they need to be weighed against the benefits. So when we talk about day-to-day living on a daily basis, I hope all of you must be taking some risks and some benefits. And by way of example, I mean, when we talk about risks in our daily lives, we are willing to take risks on which we have control. Right? For example, when you're driving an automobile, there is a risk of facing an accident. Does anybody know as to what is that risk? There are estimated probabilities of facing an accident. So what's the estimated probability? Is that depends upon the place where you stay, but it's not about 5%. But most of us, even knowing that there is a probability of this kind of risk, would you stop driving automobile? Anyone? You're going to take that risk. And the reason why you're willing to continue taking that risk is because you are in control of the situation. You are driving. You where to slow down, where to speed up. You are in charge of the situation. But if you're exposed to a risk on which you do not have a control over. For example, when you're going by air, and if somebody tells you beforehand that there is a 10% risk of this plane crashing, would you be willing to take that kind of a risk? No. And one of the reasons for not being willing to take that kind of risk is because you do not have control over it. So whenever the individuals are exposed to a risk aversion is a primary goal. Do you understand this concept? Whenever they're exposed to a risk on which they do not have control over, they do not have understanding, they would just try and avoid taking that kind of risks. And even if they have to take that risk, they would want that risk to be very, 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 very low. Is that understood? Understood or not understood? Yes. So, talking about risk-benefit analysis, so what is risk? Risk is just a probability of inducing any harm. It's a probability function. And benefit, when we talk about healthcare, that's something of positive value related to health or welfare might be conferred to a patient. That is what benefit is. This is just simplistic explanation of risk and benefit. And when you do this kind of analysis, the goal is ultimately to figure out as to whether the risk is more as compared to your benefit, or whether your benefit is much more as compared to your risk. And that is what you do when you implement any kind of treatment in your day-to-day practice. Would you like to implement any treatment in a practice where your benefits are very, very high, but your risks are much higher? Would you do something of that sort? Ethically. Why there is no answer? No. So that is what risk-benefit analysis is all about. And that is what we do when we sit there in ethics committee, when we are evaluating your projects. And again, how do you evaluate this risk? It is based on a probability function, so chance. What is the chance of that harm occurring? And what is the severity? So the probability and the magnitude, that these two in combination help you determine as to what is the risk that is involved. And there are multiple mathematical calculations also to that effect. Not that in the ethics committee we sit down and do those mathematical calculations, but yes, we do look into the probabilities and we look into the severity in order to get to a concrete, risk that might be imposed by a research to a subject. So what is the importance of risk-benefit assessment? Especially here we are talking in terms of clinical research. When you're talking about clinical research, and it helps you generate knowledge which is generalizable to the population, and it helps you understanding about the disease. But that particular research might not benefit the particular subject in question. For example, if you have a randomized trial of a drug A versus drug B, where you do not know which drug is better over the other. Now, the results of that trial certainly is going to be beneficial in terms of helping you decide for your future patients as to which is better over the other, depending upon the results of the study. But for that A particular patient, you don't know that whether that particular drug is going to be beneficial to that person or not. And that's why it is, and there might be a chance that the person, if you do not do this risk-benefit analysis in a proper way, there might be a chance that the person actually might be exploited for the sake of generating a generalizable knowledge. Is that possible? Yes. And that's the reason you need to know about your risks and benefits of a particular study. So, I mean, logically, research in humans should be initiated only if the benefits for the individual's subject or the society clearly outweigh the risks, right? And it is important to understand that the most important considerations here, I mean, even the societal, if there is a lot of societal benefit, but if that involves risking the human, the subject at hand, those kind of research cannot be allowed. So it is very important that the rights, safety, and well-being of that particular research subjects, they are maintained. And the reason why this is important is because I hope you have heard about the Nazi experiments. The Nazi experiments gave you a lot of, answers to certain research questions. So for the society, they probably would benefit in terms of understanding a disease process. But were they good for that particular research subject? They lost their lives. So this is the kind of research which is certainly a no-no. And that's the reason that this kind of risk-benefit analysis came into place. And following these Nazi experiments, wherein concentration camps, war convicts, they were subject to very non-humanitarian experiments. The Nuremberg Code came into being. These are a set of 10 ethical principles that basically help us when we are framing our research questions. So the Nuremberg Code, the bottom line is that experiments where there is a priori reason to believe that death or disabling injury will occur are clearly forbidden. And following this, you have the Declaration of Helsinki, where a set of medicine experts also sat down to bring out this declaration, and it states that the interest of the subject must always prevail over the interest of science. You might think of a very, very, brilliant scientific idea, but if it involves risking the life of a subject, it's not allowed. And of course, I mean, the second line again repeats the same, that irrespective of the benefit to the community or the society, the research subject, whether he's at risk, that holds utmost importance. And then came the Belmont report. These are a number of reports which do talk about the risks and benefits. Some of them talk about the risks and benefits to the individual only, and some of them also talk about the risk and benefits to the individual and the society. So the Belmont report talks about this. It talks about it. It is an analysis of the risks and benefits. It states that the risks have to be reduced to those necessary to achieve its objectives, and the risk and benefit affecting the immediate research subject will carry a special weight. You have US federal regulations where they talk about the risk to the subject and the benefit to the individual and the society. And again, the ICH GCP guidelines, they modified the definition of risk as to just not stating it as risk, because a lot of risk might not be known to you. You do phase 1, phase 2 experiments. From the phase 1, phase 2 experiments, you might be knowing certain risks. That's why you do those experiments and then go on to phase 3, phase 4 studies. But all the risks might still not be known. So that's why they talk of something called as foreseeable risks, something which you can anticipate or which are known. And it's important that before a trial is initiated, these foreseeable risks and inconveniences should be weighed against the anticipated benefit for the trial subject as well as the society. So these are various guidelines which do talk about the risk benefit when you are designing your research study. So what the bottom line is that the risks to the individual participants, they have to be identified. And if there is a method of minimizing it by any which way, sometimes we ask for, why this dose? Why not a lower dose of the drug? There can be many such things. So they need to be minimized. And the benefits to the individual participants and society should be proportionate, or they should at least outweigh the risks. Now, how do you assess risks and benefits? How do you do so? How did you do that in your study? Anybody? You have done your thesis, you have written your thesis protocols. What are the potential benefits? So what are the benefits? It is an antiviral that is known to the world, but what are the benefits of that antiviral? It reduces the sequelae and improves the outcome. What are the risks involved? So what are the side effects? The known side effects. So if your acute kidney injury is about 15%, would you accept that kind of a risk? Would you accept or not accept? Can you please put up your phones? I mean, it's a straightforward. If a drug is causing an AKI of 15%, although it gives you certain benefit, and I'll come to certain examples. Would you agree to such kind of treatment? So that is what you do, I think, day in and day out. Anybody else? Infections, reactions. Yes. What are the anticipated benefits?
Improvement in calm and better response therapy. means therapy can be given if the pressure count is optimized.
Which therapy?
Is according to the disorder. If we are giving chemotherapy, pressure count has to be
And what are the risks you said? So it is in general transfusing platelets in anybody who has a thrombocytopenia. There are a range of situations where you have thrombocytopenia, right? So you took all patients.
Only 2 patients below 50,000.
No, but the conditions that led to that 50,000 platelet count, what are the conditions?
Oncology patients and also other counts. Including other non-hematology and non-oncology other.
So you took oncology patients, not other. So you took a specific subset wherein you know that thrombocytopenia might interfere with giving treatment. So that's the anticipated benefit. And the risk, of course, involved are transfusion reactions and infection. So if the transfusion reactions, the incidence is about 20%, would you subject the patient to such kind of research? Yes? 20%.
And that platelet transfusion will increase the platelet count. Okay, when you're studying to give some things, it might increase the platelet count. The chance of increasing the platelet count is only 50%. The chance of side effect is 25%. Would you as a subject would like to take that drug? No. So you have to weigh the benefit versus the risk involved. That is what we are trying to tell you. Every day we are doing.
So we have radiation residents over here. You're there in the OPD, and very frequently patients come to you on follow-up, the cancer patients, and you advise them a certain set of tests. And some of the tests that you advise them are tumor markers. So do you think that there is, okay, your understanding is that there is benefit. Is there any risk involved? An asymptomatic patient coming to you on follow-up, you are advising a blood investigation, which might help you in monitoring the status of disease. Okay, that is what our understanding. Is there any risk involved here?
They might overestimate the disease.
They might overestimate the disease. Overtreatment, anxiety. So all those kinds, those are also the risks that might be involved. Any other person? There at the back, the 3 people at the back. What was your thesis? Yeah, the orange one. Yes, you. Okay, you. Yeah. What was your thesis? To assess the role of? What is that? I would not know it. I'm a layman, I would not know that. MD. Okay. So it was an assessment. So it was an observational study. Do you think that there can be risks involved in observational study as well? What are the risks? You can't ask the patient to pay for your research. Ethics committee will not allow you to do that kind of research where you are asking the patient to pay for your research. So that is economic risks, and that is something that we do not allow. Overdiagnosis. Yes. Yes, of course, it can be overdiagnosed. There can be psychological trauma. And if you diagnose the patient with obstructive sleep apnea, is there an ethical this thing to even treat it or advise him regarding the management of the same? Yes. So all that has to be taken into account when you're designing your research question. It's not that you're just doing an observational study to detect something. What after detection? What are the strategies that you're going to implement after detection of something like that? So that constitute your risks and benefits. Okay, so how do you assess, please, thank you, risk and benefits, and you identify what are the potential risks and potential benefits, the types and source. So that is what we did right now. What are the potential risks and the potential benefits? You quantify even the magnitude and duration. So magnitude means severity. So whether it is less severe or it is very severe, right? Very severe like organ dysfunction, kidney failure, acute kidney injury. Those are the kind of excess harm. And duration is also very important. For example, in cancer patients, if you have a drug that controls the disease very well, but at the same time comes at the cost of extreme fatigue for the remainder of our life, would you advise on such kind of treatment? No. So duration, again, is very important. Or for example, side effect profile, which is like lifelong. You can't, although there is a benefit to the drug, but the side effect persists for the life of a patient. So those are the kind of things that you need to weigh when you are doing your risk benefit analysis. And of course, what is the benefit? What's the magnitude and duration of harms and benefits to the research participants? And you calculate the probability of harms and benefits to the research participants. First is identify whether there is risk, whether there is benefit. What is the magnitude of risk and benefit to the research participants? What's the duration of that kind of risk and benefits? And what are the possible harms? So there are 4 categories of risk that you can think of in clinical research. One is the physical risk. Of course, that's the most common that you would know of. Something like a drug causing a side effect, that's bodily harm. That's the most common side effect that you would anticipate or know of when you're doing your study. There are certain risks such as psychological risks. Now, these are not very evident risks, which might cause emotional suffering to a patient. For example, you do certain kind of genetic mutation analysis in a patient, and the patient is found to have a mutation which portends the risk of developing a cancer at some point of time. So those are the kind of risks which can pose a lot of psychological and emotional suffering. There can be social risks, for example, certain kind of diseases which can pose difficulty in employment or social discrimination. I remember I'm a cancer specialist. One of my patients just came back to me. She's a childhood survivor of a leukemia, and she's looking for jobs. And just because of the fact that she has leukemia, she's not being offered a job. So those are the kind of risks that that can be conferred even when you are inducting such patients into research trials. And of course, economic risks, financial costs related to the research participation. And when we talk about financial costs, it's not about the direct costs. I mean, direct costs, the ethics committee will see to it that no cost is imposed onto the participants. So your research study has to be funded by you if you're doing an intervention. It is not that the research participant is going to pay for your study. Be it very clear. If there is some intervention which is new and which you are introducing in the study, that is not going to be paid by the research participant. But there are other costs. If your study mandates a follow-up, for example, the patient is asked to come for follow-up every month or every 3 months. So there are travel costs, time away from family. So these are the kind of economic risks that you can impose onto the patient. So that's why whenever you're doing your consent form, if you have done it properly, you do write in that there will be no additional visits and there will be no extra charge. Or if the patient is coming extra, the charge will be borne by the research investigator. So what are the types of, what's the risk assessment you identify? And when you're identifying the risk assessment, it is also important that when you're trying to conduct that kind of study in your center, it's important to look whether you have that kind of infrastructure, not only to do that kind of research, but if there is a problem that arises because of the research or a side effect that arises because of the research, that is possibly being taken care of at your center, right? And of course, direct risk that you will always mention, and most of you would be aware of that. And indirect risks that I mentioned, time away from family, work, risk of travel to site, etc. And so you identify, you quantify the magnitude and duration, whether it is a major or whether it is a minor harm, either it is to the individual and it can be to the society. For example, you do community-based studies and you're trying to look into the incidence of HIV. Now that is a little bit of a stigma, right? So that can pose problems for the society. So you have to be careful with those kind of research. What are the benefits? The kind of benefits that you can have on the individual, you have physical benefits, improvement in terms of improvement of disease. That's what you anticipate. There can be psychological benefits. So there are patients who would just like to want to participate in research because they would have access to the doctor more easily. So those are kind of very indirect, benefits. And sometimes when you're trying to consent your patients and you say that, okay, this research might not benefit you particularly, but it might help us understand the disease better and it might help the society at large. And there is a lot of altruism in some of the research participants, and that might confer a psychological benefit to that particular research participant, right? So that's what psychological benefit is. And economic benefits, and in terms of economic benefits, especially for drug trials and those expensive drugs which might not be affordable by the patient, those might be provided free of cost because of the participation in the study. Sometimes investigations that you do during the course of the study and which is funded by your study, like CT scans or blood tests, they of course are done free of cost. So those are the kind of some economic benefits which might be there. And all these have to be listed and seen. And of course, benefits to the society, the knowledge gain may lead to effective interventions in the future. That's what the benefit that you mostly anticipate. And it might help in changing practice standards by decreasing the morbidity and mortality. So that's for the society perspective. So what benefits should count? Are these direct benefits important or indirect benefits important? Remember, I mean, there are indirect benefits, but the most important would be the direct benefit that are counted when we are doing a risk-benefit analysis. The indirect benefits are there. You take that into account, but the weightage is given to the direct benefits. It's left. So other thing is whether the benefit is related to the trial period. So whenever you're doing a research study, the benefits of the study might be mostly it is during the conduct of your study. You are providing care or something. And there might be certain benefits to the community before and doing conduct of the research. This is particularly true for community-based research, for example, screening-based studies. So when your breast cancer screening, when it was implemented in the Western countries, the way they did it was before they went into the community. And the first thing that they did in the community was to raise awareness So that's kind of an indirect benefit to the community in terms of raising awareness for breast cancer. So whenever somebody is doing that kind of research, so you can have benefits to the community, not only during the course of research, but also before the research. And the benefits can be anticipated even after the research has been completed. The community is more aware. They have access to the health system. They know as to where to approach to if they have a problem. So those are the kind of indirect benefits that might be conferred to the community when there is community participation in research. And the benefit might not necessarily be limited during the trial period, but it also might be, some benefits might be there after the trial period. One thing about drug trials is that whenever we are reviewing these drug trials in the ethics committee is that we do ask them that after the study is over, whether this drug will be available to the participant or not. That is something that we do look into the ethics committee reviews. Then comes the magnitude, quantify the magnitude of potential harm and potential benefit, whether it is, when you talk about the magnitude, it can be as big as organ dysfunction or slight discomfort. What kind of benefits are we talking about when we talk about cancer care? It could be, sometimes we're talking about curing the patient altogether with a certain kind of treatment. And at other times, it might not be just curing the patient, it might be just causing a growth restraint or tumor shrinkage. So curing the patient is more beneficial, or means complete eradication of the disease is more beneficial, or just stabilizing the disease is more beneficial? What is more beneficial? Curing. So that's how you quantify the magnitude of benefit. And of course, the duration of potential harms and potential benefits is something that you look into. Either it is a one-time harm, or the drug might cause a prolonged harm. That's what we quantify in the duration. And what are the strategies that we should, not only you, every one of us should be deploying to reduce the risk and enhancing benefits? The first and the most important thing when you're doing your research is there has to be a very sound scientific, rational, and experimental design. Once you have this, everything else is really very well taken care of. And you have to do research consistent with the current standard of care. You can't do your research and compare it with some kind of a very historical standard. So that has to be borne in mind. And whenever there is a risky procedure, you have to see whether that procedure can be replaced by a less risky one. Of course, you need qualified professionals and persons to be able to do those kind of research. Monitoring is very important. So you have data safety and monitoring boards, which monitor the side effect profiles of certain drugs. And you have stopping rules. So if the side effects, if the side effect profile is too high, then the ethics committee might ask the PI to stop the study. And generally, you should try and exclude subjects who are susceptible to high risks. So you would not like to take a 80, 85-year-old old man to some kind of a new therapeutic drug, right? And of course, last but not the least is data privacy is very important. So coding, encryption is important for your data. This helps in protecting the confidentiality of the patient. So that also helps in reducing your risks. So what is step one? Step one is identifying the risk and benefits. You brainstorm with the research team. How do you identify the benefits and risks? It is basically by reviewing your literature. You review the literature, come back to the team and brainstorm and identify that, okay, these are the risks that I've seen that the studies have quoted. And occasionally you might seek community engagement, particularly in studies which requires community participation. The step two is the probability you identify of the benefit and harms. the magnitude of benefit and harms, and finally, you evaluate the benefit versus the risk. So in a tabular form, you calculate you have a probability, you have the magnitude, and a final evaluation as to the benefit versus risk. And occasionally, you might do a pilot study as to see as to what are the patient's perception about participating in that kind of study. And they are also used in calculating this kind of risk-benefit evaluation. Of course, review of literature and in community-based studies, community engagement is important. And the final outcome, and a lot of you, when you're doing your project submission, I think you must have come across this, that when will research be allowed? If there is a minimal individual risk but substantial benefit to the community or the individual, that's when research will be allowed. When it cannot be allowed, when the individual risks are present but the benefits are unclear. If we come across a proposal where there are certain risks, even if there are minor risks, but the benefits are completely unclear, would you like to approve such kind of a study? Or would you like to even embark on such kind of a study? There has to be some anticipated benefit. And sometimes we do come across such studies. We really do not know as to why this is being carried out. What is the anticipated benefit? And of course, certain studies, especially the drug trials, they require a careful scrutiny because the individual benefits, they are present, but they might slightly outweigh the risks. And the projects where to the individuals that the study might not benefit, but there might be a benefit to the community, these are the kind of projects which require careful scrutiny. So let's come to an example. So this is first study where they were trying to compare the efficacy of a new anti-diabetic drug and metformin. We use metformin for diabetes in patients with type 2 diabetes mellitus. So let's do the risk analysis. The new drug has the following adverse effect. It causes severe hypoglycemia in the short term, and it causes pancreatic cancer with long-term use. And metformin has the following side effects. We are aware of that: gastric discomfort and lactic acidosis. So this is the risk that you have seen. Now coming to the benefit analysis, the new drug, the benefits, why do you want to use the new drug? Because it's once a day, it's long acting, the compliance with this drug is better, it is a small size pill, it's easy to consume, the cost is low, it's a cheaper drug, it causes better glycemic control. These are reasonable benefits. Are they reasonable benefits or not for the drug? Yes. And for metformin, you know that it offers to a certain degree cardiac protection, and it is a time-tested drug. That's the benefit for metformin that we give. Now let's look at the evaluation. And when we do an evaluation, we talk in terms of probabilities. So the new drug, we spoke about severe hypoglycemia. What's the probability? It's about, we spoke about probability, right? When we're doing a risk evaluation, 1 in 1,000. And in these patients who develop hypoglycemia, 1 in 10 go to coma and 1 in 100 die. Pancreatic cancer, 1 in 40,000, and the mortality due to pancreatic cancer is very high. And with metformin, you have severe hypoglycemia, but the incidence is 1 in 1 lakh, and they don't die. Hypoglycemia is generally reversible, and it's never fatal, and lactic acidosis is extremely rare. Now, I gave you the risks, I gave you the benefits, and you are there trying to review the study, or you are there involved in the study design. Would you approve something of this sort? How many of them say no? And the remaining say yes. So the ones who have not raised their hands, can you please tell me as to why did you say yes? How many say no? How many of you said no? How many of you said yes? None of you. So that's the benefit evaluation. So the reduction in 30% reduction in HbA1c, and metformin is only 12%. The compliance to the drug is 80%. This is just 65%. The cost is 15 paisa, and this is 1 rupee. Still, you feel the same? Yeah. So yes, it is a very important. Hypoglycemia is a serious side effect. It is 100 times more common than the drug, right? And of course, better glycemic control and better compliance and lower cost. But the risks here, the risks over here clearly outweigh the benefits. So that is how you do risk-benefit analysis. And whenever you're framing your research question, you can do this kind of a risk-benefit analysis. Look into the probability of risk, look into the magnitude of harm. And that will really give you a clear answer. I would not go into the second study, and these are the guidelines by the ICMR, which helps you in classifying your risk. And the reason why I brought this table up is a lot of you do like this specimen-based research, where you collect blood samples. And most of you feel that the type of risk is less than minimal risk. It is not. The risk is actually minor increase over minimal risk or low risk. It is not, whenever you're collecting any blood sample, it is not a minimal risk. It is either a low risk or a minor increase over minimal risk. So that's what the ICMR guidelines state. And when you are submitting your research proposals, just make sure that you take the right risks. And talking about scientific value with risks and benefits, there is an inherent tension between gaining knowledge and minimizing risk. We as clinicians, we want to become, we are generally wanting to do more riskier studies in order to gain knowledge. And frequently when we have a high risk study, the opportunity to gain knowledge is also slightly higher, right? But that might lead to exploitation, and we should not embark on those kind of studies just for the sake of gaining knowledge, just for the sake of advancing science. You cannot pose an excess risk to the patients or the subjects. So all research, they have their own benefits and risks. There is inherent uncertainty also about the degree of risks and benefits. And you might get better when you do your review of literature thoroughly. You might have an assessment of these risks and benefits better. Despite the importance, the assessment is always complex. And whenever you're doing this kind of analysis, always remember, first you put yourself in that situation, and people's preferences and perceptions should also be kept into they should be taken into account when you're doing this kind of risk-benefit analysis. Thank you very much. These are some recommended reading material. I think we'll be providing them with the slides. Thank you. Any questions?